In today's Health Watch, a staffing crisis is changing nursing. Veterans of the profession are leaving faster than students are entering the career. Local 3's Connie Fellman looks at what hospitals are doing to cope.
The nursing profession is facing an unprecedented crisis as the healthcare industry grapples with a severe shortage of nurses. That's why hospitals are diligently seeking innovative strategies to revolutionize the field in an attempt to save both jobs and lives.
Experts say nearly 1 million nurses will exit the industry in the next 4 years.
Even our younger nurses that have just came into the profession are leaving the profession.
Tommy Austin has been a nurse for 34 years.
It has to change. It cannot be the way it was done during the pandemic because we just don't have the resources.
How can we expect nursing to evolve?
Working our nurses to the top of their license is one of the main objectives for our organization.
More solutions start by redefining roles or creating different levels of nurses. Expert nurses, nurses with masters, and nurses with associate degrees. And some nurses even working from home, leveraging telemedicine and technology.
A lot of nursing time is taken up by working on that computer and inputting that data.
Robots are also beginning to play a critical role.
Nurses sometimes clock 20, 30,000 steps a day. And so if we can have robots that can pick up medications from the pharmacy or take medications to the pharmacy, pick up labs, take labs, specimens down to the laboratory.
AI can also become an extra set of eyes to help monitor patients.
What that artificial intelligence can tell me is that, Tommy, you need to watch that. There's something going on with that patient.
Transforming an industry and saving lives.
Because I love people, nursing is a profession that I probably could work until I'm 100.
Stress seems to be more of a problem than money. According to nursing.org, nurses are earning more money than ever before. RNs earn around $80,000 or more per year, and there are more and more specialized degrees that can get as high as $200,000 a year. And that's your Health Watch. I'm Connie Fellman, Local 3 News.